The Children's Health Project of DC is our mobile health program at Children's National Medical Center. It's also affiliated with a national partner, the Children's Health Fund. We provide mobile medical and dental services out in the community. We bring services to the community where their community has been void of services in the past. So where there hasn't been a doctor, where there hasn't been a dentist, we actually use our mobile units to provide access to care. 25 years ago, Dr. Erwin Rutland, a pediatrician, and Paul Simon, the singer and songwriter, saw that kids living in homeless shelters in New York did not have a usual source of care. So they took an RV and outfitted it and made it into a mobile medical clinic, a clinic on wheels. Dr. Erwin Rutland has started providing services to those kids in the homeless shelter. And the testament that this was a model of care that needed to be replicated throughout the country was that after these kids moved out of the homeless shelter, they still came back to get their services on the mobile medical clinic. So now we actually have 23 programs in 18 states plus the District of Columbia to provide these services. We have 4 units in our fleet, 3 medical units, and then 1 dental unit. We also, as part of our program, provide social wraparound services. Any services that you can get in a doctor's office, we can actually do on our mobile units out in the community. So hearing, vision, immunization, lab work, referral to subspecialists. We all do that with our mobile health program. In addition, we do provide a lot of community outreach and education. We're always at health fairs in the spring and summertime, promoting our services and also educating the community on healthy behaviors and healthy living. One of the programs, our Teen Steps of Success to Wellness program, is a 30-week program that we offer where we have teens come in for 30 weeks in the school year to get education on various topics, peer pressure, domestic violence. We also have an adult version of our Steps of Success to Wellness program where we teach the adults about diabetes, HIV, health and wellness, child development, because we really believe that it's important to educate the adults who will then role model healthy behaviors for the families. In addition, we provide a referral management initiative through the Children's Health Fund. Any referrals that we make to subspecialists in the community, they look to identify what the barriers are for our families as far as going to those appointments and try to help them navigate the healthcare system, which can be very complex.
In the past, I've had to travel all the way to Georgetown to get some services, and it's not convenient. And when I didn't have a car, I have to get on the bus and travel to all of these places, and the mobile health clinic is right here in my neighborhood.
We have some locations that we've been going to for 20 years, the entire duration of the program. We link with schools. One of the locations we actually go to is the DC Promise neighborhood. We service Cesar Chavez Public Charter School within that footprint to provide services there. Our medical and dental units go to that location. We also provide services near public housing. One of the areas we go to is Atlantic Terrace, where we have been providing services there for 20 years, and also the Fort DuPont community in Washington, D.C. The site utilization can be tricky just because utilization of the unit can vary depending on weather, can depend on school schedules. But what we try to do is identify champions. Champions within the schools, champions within the community that then approach us and say, this is a community that needs your services. And then we evaluate whether or not that's really what the community needs. It's important to really get that feedback from the community.
When you can just pick up the phone and make a phone call to the doctor's office to let them know that you're either on your way to bring your child and they can offer you a same-day appointment, that's like a jump for joy for me. Where we went before, we didn't get all of that. We didn't get all of, we didn't get the phone calls of confirmations. We didn't get same-day services. We sometimes had to wait 2 and 3 days to be able to be seen for a sick visit. So the fact that I can get that with the mobile health clinic, I'm overpowered with joy.
The mobile health team is really a family with the community. We have patients that we've served for generations. We've had patients that we're serving the kids, now we're serving their kids, and this is all a testament to the great work that our team does. So I really think it speaks to that family connection that we have with the community.